in place consisting of limited movement out of cell. All inmates will only be allowed out of their cells for showers and phone calls. Food will be delivered cell to cell. Medication will also be delivered cell to cell. There will be no movement of inmates from their respective units, and all inmates are being provided with masks. We know advocates for all of those housed in congregate settings are worried, but the fact is we are going to great lengths to keep everyone safe, participants and staff alike. Finally, we've mentioned already this week that Streets Department has been challenged with maintaining trash and recycling collection on a consistent schedule. So starting next week, recycling materials will be collected on an every other week schedule. Residents should hold their recycling materials for the week of Monday, April 6th through Saturday, April 11th. Recycling collections will resume on Monday, April 13th, with every other week collections running through May 15th or further. Again, residents should hold their recycling materials in their homes next week, and recycling will resume the following week. Regular trash collections will continue on or as close to its normal schedule as possible. Residents should expect some delays as the health crisis continues to have an impact on employee attendance. There will be no trash collections on Friday, April 10th in honor of the Good Friday holiday. And now Dr. Farley to provide a health update.
Thank you. So since our time yesterday, we are continuing to see a rapid growth of cases of the coronavirus infection in Philadelphia. Our healthcare system is seeing that with more patients being admitted to the hospitals, but they are still widely available and prepared to deal with additional patients. And we have new guidance from the Centers for Disease Control that is upcoming about face masks that I'll talk about in more detail in a minute. So more background on those key points. Since this time yesterday, we've had 330 new cases of coronavirus infection diagnosed in Philadelphia residents, bringing us to a total of 2,430. That daily increase of 330 is less than the increase that we reported yesterday of 360, but I would be cautious in interpreting that because our data comes in batches, so we want to follow the long-term trends, not so much the day-to-day changes. For people who want to know more about the demographic information of the cases, all that is being posted on our website. We are continuing to see clusters in congregate settings, as Mr. Abernathy just said, including nursing homes and behavioral health facilities and the city's jail. We now have 31 inmates in the city's jail who have tested positive for coronavirus. All of them are receiving the medical care there that they need. And we're working with the jail to contain that spread of that infection within the facility. I do have to report, unfortunately, we have 9 new deaths since this time yesterday, 26 total since the beginning of this epidemic. Here's the age range of the 26 total people who have died. 1 was between the ages of 40 and 49. 2 were between the ages of 50 and 59. 2 were between the ages of 60 and 69. 11 were between the ages of 70 and 79. 7 were between the ages of 80 and 89, and 3 were over the age of 90. I was asked about the racial breakdown of people who have died. We have partial information on that. Of those 26, we know that 10 were white, 9 were African American, and the rest had missing information on race. Of the 26 who died, 13 have been in nursing homes. A little bit about testing. Testing is still available at most hospitals, has really unchanged. It's by referral. In general, the criteria for testing is people who have symptoms who are over the age of 50 or are healthcare workers. Testing will be available at the Citizens Bank Park today from 1 to 6 p.m. Without appointment for people who meet those criteria, weather permitting. And our additional Center City testing site is available for people who meet that criteria. And if you're interested, call 1-267-491-5870. Our hospitals are preparing for the increase in the number of patients with coronavirus infection. So far, as of this morning, there were 356 patients with this infection reported in city hospitals, and a total of 656 patients with this infection reported in hospitals in the entire Southeast Pennsylvania region. We expect those numbers to continue to rise in the coming days. Despite that, 47% of our general medical beds are still available, so there's plenty of capacity. And our emergency departments still are about half of their normal volume, so there's plenty of capacity in the hospital emergency departments. We want to remind everyone again about the importance of staying safe. Stay home unless you have to go outside for an essential task, like going to get food, to get pharmaceuticals. If you have to go out, keep your distance, and then wash your hands after you touch something that someone else has touched. Now, about this new CDC guidance, we were notified last night the Centers for Disease Control will soon be coming out with guidance recommending that people who are outside the home wear a non-medical face mask when they're outside. This is a non-medical face mask. We're talking about a cloth mask, not the medical masks that are purchased and used for healthcare workers. There is a severe shortage of the medical face masks, so we want to reserve that for the healthcare workers that we know are at the greatest risk. Now, this recommendation for people to wear a cloth mask is not a reason for people to go outside the home more. The recommendation is still for people to stay home unless they absolutely have to leave the home. What does this do? By wearing a face mask, you protect the people around you. So my mask protects you, your mask protects me. The idea is that this infection is widespread enough that this recommendation will help protect the people around those who are wearing a mask. So the City Health Department will follow the guidance from the Centers for Disease Control. We're waiting to see exactly what it says, but that's what we're told is it's going to be the main message. For more information in general about this, go to www.phila.gov/COVID. At that site, there is actually instructions on how you can make a mask that meets the recommendations of the Health Department. And if you have questions about the health issues, call 800-722-7112.
Buenas tardes. El mensaje del alcalde Kenny para el día 3 de abril del año 2020. Este fin de semana tenemos un pronóstico de buen clima para la ciudad y les recordamos a todos los habitantes de Filadelfia que la orden de permanecer en casa sigue vigente. Mantenerse en casa y alejado de otras personas es la mejor manera en que podemos ayudar a reducir la propagación del COVID-19. Instamos a todos a respetar la distancia social de 6 pies cuando estén en la calle o cuando visiten los parques y senderos que se encuentran abiertos. Les recordamos que todos los parques infantiles y las canchas deportivas están cerradas y que no se permiten los deportes en grupo. Para finalizar el día de hoy, el personal de Parques y Recreación habrá retirado todos los aros de baloncesto en 50 locales y está monitoreando activamente sitios adicionales donde tal vez debamos intervenir también. En otros temas, el mes pasado inauguramos el fondo PHL COVID-19, un fondo único de respuesta regional creado en asociación con United Way of Greater Philadelphia y Southern New Jersey y con la Philadelphia Foundation. Informamos que el fondo PHL COVID-19 ha recaudado $11.300.000 de más de 1.800 vecinos en el área metropolitana de Filadelfia. Muchísimas gracias por ayudarnos a ayudar. Recuerde que ninguna donación es pequeña y que usted puede donar ingresando al phlcovid19fund.org. Asimismo, estamos trabajando para que cada niño matriculado en una escuela del Distrito Escolar de Filadelfia tenga una computadora portátil que le permita continuar aprendiendo de forma virtual. Les damos las gracias a los Sixers, al Bank of America, a la familia Roberts y a todos los que han hecho posible que nuestros niños puedan seguir aprendiendo durante esta crisis. También quiero agradecer a Philadelphia School Partnership, que creó el fondo Jumpstart Philly Schools para garantizar que los estudiantes de las escuelas charter y católicas tengan apoyo a raíz de esta pandemia. Finalmente, muchos de los edificios emblemáticos y monumentos de Filadelfia brillarán con el color azul el próximo día martes 7 de abril en honor al Día Mundial de la Salud, para honrar a los trabajadores de la salud y a todas las personas y organizaciones que están trabajando arduamente para contener la pandemia del COVID-19. Gracias por este simbólico gesto para reconocer el trabajo de pocos para mantener saludables a muchos. Este es el mensaje de Brian Abernathy, director general para el día 3 de abril del año 2020. Buenas tardes. Las personas sin hogar ahora son más vulnerables que nunca. Como es un servicio esencial, el sistema de refugios está abierto para albergar a casi 3.000 desamparados cada noche. Hay más de 60 organizaciones sin fines de lucro que son parte de nuestro sistema de servicios para los desamparados. Ellos están haciendo un trabajo extraordinario contra viento y marea. Nosotros estamos tomando medidas para garantizar la seguridad de estas personas. Entre ellas, tenemos el establecer un distanciamiento de 6 pies entre las camas y distribuir alimentos bajo la modalidad de grab and go, es decir, para llevar. El personal en los refugios está brindando información sobre el virus, monitoreando síntomas y derivando a las personas que lo necesiten para obtener atención médica y pruebas según sea necesario. Hay camas disponibles en los refugios. Las camas de invierno se mantienen abiertas y la capacidad en Center City se ampliará en 100 camas. Estamos también buscando abrir un sitio en Kensington que pueda albergar a 100 personas más. Las personas son examinadas para detectar el COVID-19 y cualquier persona con síntomas recibe atención médica en vez de ser admitida en los refugios. El Departamento de Salud está trabajando con todas las instalaciones que albergan grandes cantidades de personas y esto incluye las prisiones. Las medidas que está tomando el Departamento de Prisiones son las siguientes. Todos los reclusos están siendo alojados bajo la modalidad de shelter in place, lo que significa que tendrán sus salidas limitadas fuera de su celda. Los reclusos solo podrán salir de sus celdas para bañarse y hacer llamadas telefónicas. Los alimentos y medicamentos les serán entregados en sus celdas. No habrá movimientos o traslado de recursos de internos o reclusos fuera de sus respectivas unidades, y todos ellos recibirán mascarillas. Finalmente, anunciamos que hay un cambio en el horario para la recolección de los materiales de reciclaje, que desde ahora se recogerán cada 2 semanas. Los residentes deben retener sus materiales de reciclaje durante la semana del lunes 6 de abril al sábado 11 de abril. La recolección de reciclaje se reanudará el lunes 13 de abril y se repetirá cada 2 semanas hasta por lo menos el 15 de mayo. Esta es ahora la actualización en materia de salud del comisionado Farley para el día 3 de abril del año 2020. El sistema de atención médica está disponible para todas las personas que lo necesiten, independientemente del idioma que hablen, su estatus migratorio o si tienen seguro médico o no. Este virus no discrimina por raza o por género. Desde ayer a la 1 de la tarde se han confirmado 330 casos nuevos de coronavirus en Filadelfia. Y actualmente tenemos 2.430 casos confirmados en la ciudad. Hay 31 casos confirmados entre los reclusos. Reportamos 9 fallecimientos en Filadelfia, con un total de 26 personas que han muerto por la COVID-19. Esa es la información que podemos proporcionarles hasta ahora. Una persona entre los 40 a 49 años de edad, 2 personas entre 50 a 59 años de edad, 2 personas entre los 60 a 69 años de edad, 11 personas entre los 70 a 79 años de edad, 7 personas entre los 80 a 89 años de edad, 3 personas por encima de los 90 años. Información en cuanto a la raza de los fallecidos, 10 blancos, 9 afroamericanos y no se tiene información de la raza de los 7 restantes. 13 de esas 26 muertes han sido en hogares de ancianos. Las pruebas de despistaje están disponibles en la mayoría de hospitales, pero deben ser ordenadas por su médico primario o médico de cabecera. Recordemos que las pruebas deben administrarse a personas que tienen síntomas, son trabajadores del sector salud, trabajadores de los centros penitenciarios o personas mayores de 50 años. Sobre el centro de pruebas del Citizens Bank Park, hoy está abierto de 1 a 6 de la tarde. Respecto al nuevo centro de pruebas en el centro de la ciudad, estará abierto de 9 a 5 solo por cita y para hacer una cita debe usted llamar al 267-491-5870. 267-491-5870. Recuerde que debe ser referido por su médico primario o médico de cabecera. Los hospitales están preparados para el aumento de los casos. Los pacientes hospitalizados con COVID-19 son 356 en Filadelfia, 656 en la región sureste de Pensilvania, aunque se espera de que este número aumente. Hay una nueva orientación y guía del Centro de Control y Prevención de Enfermedades. Las personas que estén fuera del hogar deben usar mascarillas. Pueden ser mascarillas de tela, no necesita ser mascarillas médicas. El uso de las mascarillas médicas queda reservado para trabajadores sanitarios. Recuerde que el uso de la mascarilla nos protege a uno y a todos los demás. La ciudad de Filadelfia adoptará este protocolo del Centro de Prevención de Enfermedades. Se les pide a las personas respetar la orden de permanecer en casa y si no es absolutamente necesario, por favor, no salga. Le invitamos a consultar el sitio web para obtener mayor información www.fila.gov/COVID. Recuerde que puede usted llamar al 311 si tiene preguntas sobre la COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Gracias.
Okay, thank you, Armando. And thank you again for joining our daily press briefing. If you are logged into the Zoom call, reminder that this is for press only. And if you have not done so already, please add your media affiliation to your login name so we can recognize you and others will be removed. All participants will be muted until we recognize you. And if you would like to ask a question, please use the raise your hand function, which is listed under participants, and then we'll unmute your microphone when it is time. And again, we have limited time during this briefing, so please limit your questions to the three most important. First, we go to Pat Loeb of KYW.
Thanks, Mike. I had a couple. So one, what happened to the fire and police academy classes that were in progress when the stay-at-home order started? Were they considered essential, or have they been paused?
Yes, they were considered essential, and both police and fire classes have continued.
Okay. And on those congregate care cases, I understand there's at least one homeless person in a shelter who contracted the virus and was not moved to like the Holiday Inn Express, or it was just isolated within the shelter. So I was curious about who is in the Holiday Inn Express? Are they actually homeless people? How many people are there? And are there any quarantine rooms yet?
Sure. So we have been finalizing our operations plans for social services. We believe those plans are finalized, and we expect to be fully operational for those with special needs, like those that are unsheltered, in the next day or so. But that has taken us some time to get operationalized.
Will you start to report cases among or in homeless shelters?
I don't know if we're going to be aware of all cases in homeless shelters, and again, I think our hope will be to move any case, symptoms, or those who have tested positive into one of our quarantine or isolation facilities. Our goal is not to have any cases in our homeless shelters.
Okay, thanks.
Thank you, Pat. And next, Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, of the people who are hospitalized, how many are in critical or intensive care, and how many ICU beds exist in Philadelphia?
I don't have numbers for you now. I can tell you that there are still open ICU beds, and I don't know how many of the COVID patients are in ICU.
Okay, gotcha. This question is from Joe DiStefano. He has talked to neighbors of delivery warehouses, which are seeing a surge in demand, and the neighbors are seeing discarded sanitary gear on sidewalks and trucks blocking traffic and things like that. Is the city doing anything to specifically address the GoPuff warehouse in South Philadelphia, or delivery companies generally, regarding residents or neighbors' complaints about this facility?
This is the first time we're hearing this, and you know, this is a special situation where people are dealing with these issues for the first time probably in a generation or two. If there are specific complaints that we can address, we will, but people need to have some patience and allow us to continue to move through this. It won't be forever, and sorry for the inconvenience, but people need to get what they need, and if there's specific instances of where people are parking that are illegal or unsafe, we can address that, but people need to kind of ease up a little bit.
Thanks very much. And lastly, if we could get just an update on the masks, the shipment of 500,000 masks that the city ordered, what's the status of that? And then Brian, the national stockpile delivery that you mentioned yesterday, has the city unloaded or inventoried that?
So the 500,000 masks that I had referenced, I thought I had said earlier this week that it was has been canceled. If I hadn't, I apologize. But yeah, that was canceled earlier this week. Never got out of Europe. On the national stockpile, we have begun to unload it. I believe it's actually directly to the hospitals, and so we don't have direct insight into exactly what was in that cache of supplies. But it has been distributed to hospitals.
Is there a new order now that that one has been canceled?
We are working consistently to identify and source multiple sources of PPE. So that is an ongoing and kind of top priority mission for us.
All right, thank you, Sean. Next, we have Mitch Blocker of NBC 10.
Thanks, Mike. Dr. Farley, this question is for you. How concerned are you about exceeding local hospital capacity because you're going to have to treat patients from New York or other hotspots?
I'm sorry, I didn't understand the question. Can you repeat it?
Yeah, how concerned are you about exceeding our local hospital capacity because of treating patients from New York or other hotspots?
You know, under ordinary circumstances, the Philadelphia hospitals serve as resources for the entire region. The New York City area hospitals are going to be full, and so we are receiving patients from New York. We will continue to receive patients from New York. You know, I get this question often enough, I feel like I need to address it. Some people, I think, want us to build a wall between New York City and Philadelphia, and we're not going to do that. These are people who need care, and if they need care, we're going to provide care to them. We may not like those New York City sports teams, but the people in New York deserve medical care too.
Is there a plan if local hospitals reach capacity? For example, would someone from Philadelphia have any priority over someone from another region?
No, we're going to work at this best we can. There's a plan for the hospitals to expand their capacity within their existing facility. There are plans for adding additional facilities as necessary. And there is a plan that we're talking about every day to try to reduce this epidemic wave by social distancing. So we're putting all those measures in place and trying to take care of everybody. And everybody who needs medical care in Philadelphia will receive it.
Thank you, sir. One question for the mayor. Mr. Mayor, have you been in contact with Mayor de Blasio in New York about helping with their hospital capacity?
No, I've not had any conversations with either the mayor or the governor. Again, you have to remember, and I know this from my own parents who live in New Jersey, their doctors are in Philadelphia. So my mom's still alive. If she had a need to go to a hospital, she would come from southern Jersey to our hospital here at Jefferson. So because we're a region, the hospital practice, the doctor's practices treat people in Delaware County, Montgomery County, New Jersey, you know, that's just, we'll plow through it and take care of everybody we can take care of. But the original question, I have had no conversation with Bill de Blasio or with Governor Cuomo about any New York patients.
Do you plan to reach out to offer any help?
No, not at this time. We're still working on our stuff.
Thank you.
Thank you, Mitch. Next up is Martin Pratt of Philly YBN.
Hi, thank you for this and what you guys have been doing every day for as long as it's been going on. Quick question to Brian. One question. Does the governor's order that he issued 2 days ago, how does that affect the Philadelphia court system? And also, how does it frame at all our date? I know we've talked about stay at home indefinitely, but he gave an order for all of Pennsylvania until April 30th. And does that affect the eviction court system?
Yes, the courts actually issued a new order. The Supreme Court issued a new order extending the court closures at least until April 30th, and I have to go back and look at the order to remember the exact dates. So eviction court has been delayed. The courts are hearing emergency petitions still, and specifically as it relates to the jail population, to bring down our jail population going forward. And I appreciate the court's cooperation in that.
Thank you.
All right, thank you, Martin. Next up, Annie McCormick of 6ABC. Annie, are you there? Excuse me. Annie, let me try this one more time. Hold on one second. Try it now.
Can you hear me?
Yep, we're good.
Okay, good. I have 3 questions. I have 2 for Brian or the mayor. First one is, I heard you say, Mayor, that to alert 311 if you see groups of people playing basketball. I assume you also mean that for groups just in general in parks. But what is the enforcement aspect of that going to be? Has that changed at all at this point?
So as we have said, enforcement of groups of individuals will start with warnings from officers, verbal warnings, and efforts to break up those groups. Officers can use their discretion for increased enforcement like code violation notices. They would also ask, before that CVN was issued, they'd also ask for their supervisor to attend, to assist, and make sure that they were taking appropriate judgments.
Okay. My second question is for Chad Pradelli. It's in regards to gun permits. Is the gun permit unit closed now in this city, and why? And can you also address license to carry extensions?
So we are not issuing gun permits at this point. That is not an essential function. I'll have to look at and get back to you all on extensions for a license to carry.
Okay. And third and last question is for Dr. Farley. You touched on this a little bit. The way I understood it, you are suggesting that people wear cloth masks, not the N95 masks. In your opinion, would scarves or pieces of cloth over your face be the same as the cloth masks that we generally see people wearing? Are they the same, different? What's your opinion?
In general, the tighter the weave, the smaller the holes in the fabric, and so the more that cloth is going to protect the people around you. So there is recommendations specifically on our website about if you want to make one of these, how to do that. A scarf is probably better than nothing, but far better to have something that has a tighter weave. But also, we are awaiting the CDC guidance, which we hope will give us more detail on this.
Okay, thank you.
Thank you, Annie. Next up is Layla Jones of Billy Penn.
Hi. One question I have, has there been an uptick in street work and repairs? I've seen and heard a lot of work going on the streets, and I'm wondering if with people driving less, there's an opportunity to make more repairs.
So there has not been an uptick in street repairs. We are continuing with work that we have considered essential, so essential infrastructure repairs going forward. But again, as the governor's order and our order have indicated, that we are trying to keep construction to core and essential services. So we have not increased our street repair at this point.
Thank you.
Mm-hmm.
Are you good, Layla?
Yep, thanks.
Okay, thank you. Next up is Joanne Pileggi of Fox 29.
Hi, you can hear me. Good afternoon, everyone. This question would be for Brian Abernathy. We're working on a story today about homelessness. You did mention 3,000 people on the website. It said that there were some 5,800 people homeless in Philly in 2019. I'm just trying to get a better number when we talk about homelessness. First of all, that's my first question. Also, you mentioned reducing density within the homeless shelters. What about on the street where homeless people are congregating right now, who may not know anything about social distancing, therefore perhaps spreading the virus even further among the homeless population who are on the streets more than most people are right now?
Sure. So on numbers, I think we can get back to you with more specific numbers. We have a point-in-time count that's done every winter that gives us the most up-to-date numbers. But as you can imagine, census for our homeless population is challenging, but we certainly do our best. Regarding social distancing for those that are unsheltered, our outreach teams have actually done a tremendous job, and I will say a heroic job of educating our unsheltered population to get to social distancing. A number of folks, specifically in Kensington, are also suffering with addiction, and we recognize the challenges that brings. As I referenced in my remarks, it's important that we provide somewhere for those individuals to go, which is why we are trying to stand up a very low barrier shelter for those individuals, for somewhere to go, but also to promote that social distancing. This is not an easy issue, and as I talk to my colleagues across the country, both on the county and city level, this is something that all of us are trying to struggle with and understand. And I don't think any of us have the answer, but we're certainly doing our best with our social service providers to protect our homeless and unsheltered.
You mentioned that obviously the shortages of food that would typically be going to homeless shelters, and if homeless people are on the streets, they might be panhandling, getting a few dollars here and there where they could perhaps buy some food or otherwise something else, but they don't have the money right now to buy food, and if there are shortages of food in homeless shelters, does that not create a greater concern that this might be getting, well, like the whole thing, getting worse before it gets better? And how do you address that? I mean, it's a monumental issue, I'm sure.
Yeah, I mean, it is absolutely a concern. We're worried about the people who are unsheltered. I think we've recognized there's a very real need for food and hunger, not just amongst our unsheltered, but again, amongst our general population. That's why we've stood up, 40 general food distribution sites, 80 sites dedicated to students, and another 20 sites for seniors. It's also why we're looking at adding food distribution in Center City for the unsheltered population specifically, as well as Kensington, and working through those issues. Food insecurity is, I think, probably outside of just managing the virus and the devastation the virus is causing, but also food insecurity is probably our #1 concern.
Okay, and finally, I think I saw something in the Inquirer today about Kensington and dealing going on more than any other time before. Obviously, the police resources they're doing what they can, but it's like an open air market over there, and obviously homelessness and addiction go hand in hand. I don't even know how you begin to combat that when police have other matters to deal with, but how are you interfacing those two problems?
The challenges of dealing in Kensington aren't new. I think they're probably more pronounced and visible given the lack of activity on the street. But these are challenges that our police department, our social workers, our addiction specialists have been working on for a couple of years. So in addition to the challenges of being a poor city, a city managing COVID-19, and a city dealing with the worst opioid epidemic that the country has seen, we're very focused on those issues, and our police department is doing its best to discourage dealing, but addiction's a disease, and we're going to continue to try and combat this from both perspectives, treating those who are suffering with addiction, providing them options and getting them into treatment. All of our treatment providers are still open and providing services, as well as providing support for our residents who are trying to manage and deal with the quality of life issues that they're facing. That work hasn't stopped and is continuing ongoing.
Thank you for all responses, realizing that you guys are dealing with a myriad of issues, and thanks again.
Well, thanks, Joanne.
All right. Thank you, Joanne. Next up is Shara Arias of Telemundo. Give me 1 second here. Try it now.
Okay.
Shara, are you there? Yeah, good.
Hi, good afternoon, everyone. Thank you. Okay, Armando, mis preguntas son las siguientes. La primera es, sabemos que hay una sobrepoblación de personas en los hospitales debido a la situación y el aumento de personas en los hospitales. ¿Qué tiene la ciudad planeado que van a hacer las autoridades para mitigar esta situación? en dado caso. Y por tal razón, es cierto que la ciudad tiene planes de cerrar parte de la calle Spruce para colocar carpas para los pacientes o básicamente hospitalarios.
We know there's overpopulation of patients in hospital. What is being contemplated to reduce this? And is it true that the city is planning to close off sections of the Spruce Street to install tents for patients?
The city is working with all of the hospitals that all have plans to how to expand their capacity in a variety of different ways, and they're looking at many ways to do that. I can tell you that the story that said that they were going to put a tent on Spruce Street was way beyond what is actually being planned right now. No place can close off a street without involvement of the city. I think that there are many options being considered, but there are many plans to expand capacity so that we can accommodate every patient who needs care.
La ciudad está trabajando con todos los hospitales y hay planes para expandir la capacidad de estos hospitales, pero hay muchas maneras de hacerlo. La historia sobre las carpas en la calle Spruce no es válida por este momento. La ciudad no lo puede hacer solamente, tiene que ser un esfuerzo conjunto y hay varias opciones que se están contemplando para poder resolver este tema. No es la única.
Perfecto. Tengo entendido que más o menos ya le han respondido, pero obviamente necesito preguntarle en español. ¿Cuáles son las medidas que va a tomar la policía para mitigar el distanciamiento social, especialmente en áreas como Kensington, donde las personas continúan aglomeradas afuera? Y esto obviamente es una amenaza a la salud pública. Yo personalmente estuve allí hoy y yo vi como había muchas personas en diferentes áreas de la ciudad aglomeradas. ¿Cuál va a ser la respuesta de parte de la policía? ¿Qué van a hacer ellos para controlar eso?
What measures is the police taking to promote social distancing, especially in areas such as Kensington, where people continue to congregate outdoors? Today I was out and I saw areas where people are hanging out in groups, threatening public health. What is the police going to do?
The first step is that police provide education and issue warnings, and at the officer's discretion, they can issue code violation notices, which carry a $100 fine for failure to disperse or disorderly conduct. In Kensington specifically, it's very important that we provide another location for people to go, which is why we are focused on providing a low barrier shelter to try and break up some of that congregation.
El primer paso, por supuesto, es la educación. Los oficiales de policía saben que pueden emitir advertencias, pero queda a discreción de los oficiales de policía el hacerlo. También pueden dar papeletas que tienen un costo de multa de $100 por no cumplir con dispersarse o causar un escándalo en vía pública. Sabemos que tenemos un problema en el área de Kensington y tratamos de encontrar alojamiento para la gente que vive ahí para que pueda estar en otras áreas donde pueda encontrar alojamiento.
Por último, se espera que la Casa Blanca y el CDC insisten a la población que use máscaras o tapabocas para minimizar la propagación del coronavirus. ¿Tiene la ciudad pensado en exigir esto a sus residentes, ya que lo hagan vez en que anuncios se realicen?
It is expected that the White House and the CDC will instruct people to wear masks to minimize the spread of the coronavirus. Is the city thinking to demand or to recommend that residents wear them once its instruction is given?
We will follow the recommendations of the Centers for Disease Control on that.
La ciudad va a observar las instrucciones que emita el Centro de Control de Enfermedades al respecto.
Thank you so much. Gracias.
Gracias.
Thank you, Shira. Now we will move to Jake Bloomgard of WHYY.
Hi there. We're just kind of seeking general comment on something. The courts just sent out an email saying they reached an agreement to review and release some of the incarcerated people in Philly, and we're just looking for, a comment from the mayor or from Brian about that.
As I've said before, over the last 4+ years, we have been reducing our jail population substantially. The only thing we've ever asked for was a process that's dependable and transparent, and we know who's being released. Those petitions are being considered by the courts. The mayor's office, whoever the mayor is at the time, does not have the ability to release anyone from prison. It's up to a judge. So what we've tried to put in place is a process that's dependable and proceeds at a decent rate, where these individuals are considered based on what they're charged with, why they're there, and what their nonviolent situations may be. And this is what we wanted all along. We've reduced our prison population by 40% over the last 4+ years. We understand that this is this situation is urging us to do some more, but it has to be done in a thorough way to make sure people are safe and we're not releasing the wrong people.
Great. Thank you.
Jake, are you good?
Yep, I'm good.
All right. And next we'll move to a second round. We have Martin Pratt of Philly YBN.
This question is for you. Has there been any discussion or plan about how to utilize the time that the school system is not in session to fix some of these schools that have the asbestos and lead in them?
So yes, we have had conversations with the school district, and they do plan to move forward with both asbestos and lead abatement.
Thank you.
Okay. I see no other questions. Does anyone else have anything at this point? All right. Well, thank you very much. Again, we are on a Monday to Friday schedule for these live press briefings. We will issue press releases Saturday and Sunday and be back here at 1 p.m. on Monday. Thanks.